Welcome, welcome, welcome to this week's 3 Global Wellness Wednesday. Now, of course, depending on where you are located at, it may actually be your Thursday. So today you can expect to get some great knowledge from my brand new friend, Dr. Caroline Hong. And you're also going to hear some amazing health testimonials from real people that are getting real results. Now, remember, as we're talking today, we are not talking about treating, curing, or diagnosing any diseases. What we are talking about is feeding your body nutrition so that the body can work to its best ability. We are addressing 4 things with supplementation: malnutrition, toxicity, inflammation, and oxidation. I am your host, Kassy Havel. I'm from a small town in Central Texas, USA. I am a nurse. I've been a nurse for 25 years. I spent 2 decades in modern medicine. And for the last 5 years, I have been pretty much focused into proactive wellness. I kind of fell into proactive wellness because my husband got really sick. I went to work one day and I had a normal family of 6. And when I came home, my husband uh, couldn't stand up on his own. Long story short, he ate some bad chicken and his body didn't do well with it. It decided to attack the nervous system instead of attacking the bacteria from the bad chicken. We had a very long recovery. And 3 years after the health crisis, I remember sitting in the doctor's office and him telling us, you just need to be thankful that Guy has recovered as well as he has. And I remember feeling this strong feeling of, okay, so the fact that he just goes to work and he comes home and he sits on the couch and he's not active with our kids and we're not able to have conversations like we used to, I'm not okay with that. And I don't believe that that is where we as a family and where my husband really deserved to spend the rest of his life. So I started, researching things. And because I'm a nurse, maybe my training didn't geared more towards the nutritional side. So it took me a long time, about 8 years of research before I fell into proactive wellness. And long story short, we addressed malnutrition, toxicity, inflammation, and oxidation, and his body was able to create new pathways and, new things to where he was very active after work. He and I started to have conversations again. His relationship with the kids changed. So that's why I'm here. That's why we talk about this. That's how I was able to meet my very good friend, Dr. Caroline Hong. She is all the way from a little beach town in Australia. Isn't that crazy? I'm from the USA. I'm just a small town girl. And here I am meeting an amazing lady who has had 40 years in health and wellness. She spent half that time in preventative dentistry and half that time in the medical sector. She had some really humble beginnings, but now in her area, she's known as a pioneer of women in leadership by being the first female of numerous professional association boards in Australia and New Zealand. Guys, I'm telling you, you are going to learn some amazing things from this amazing woman. We are so blessed to have her with us. She has a bachelor's in dentistry, a master's in healthcare administration, and tons of other educational accolades. I love that both of us also have a background with quality management. So getting down to the root of things is what quality is all about. So Dr. Hong, I'm super excited to have you on. Um, wow, it's Thursday for you, right?
Yes, it's
Yeah.
Thursday. It's midday Thursday.
Oh, okay.
I know it's
Um,
evening for you.
yeah. Now I know I only touched a little bit on your background, but I really think we would be here for days because you have accomplished so much in the 40 years that you've spent in health and wellness. But with your vast experience, and of course, you can touch on more things than what I touched on while you answer this question for me, but what made you decide, with all your experience, to join the global movement of three and proactive wellness?
Well, thank you, Kassy. Thank you so much for your very kind and generous introduction. It's all because I've lived a long time, which is why I sometimes joke I have so many letters after my name. But it's only this industry that I stumbled into during the lockdown, which then opened a whole new world for me. It has to replace all my old beliefs, and I have to unlearn certain things and relearn new things. But just very briefly, yes, 40 years in healthcare industry. So I went to dental school to got a bachelor of dental surgery. I went to business school and got my graduate diploma in health administration. I went to medical school to get my master's in health service management. So over the 40 years, I've been very fortunate in my career to be on both ends. I've been a consumer of health services. My husband and I have had our health challenges in the past, but I also have been a clinician providing services to diverse backgrounds, in a hospital setting, in a community center, in a school setting, in homes for domiciliary care, even in mental institutions, and even in a interdisciplinary environment where I used to practice also a little bit of oral medicine when I worked at the Royal North Shore Hospital in Sydney. So the specialists will always call me to come in and have a look at the mouth before they go into to have their transplant. And then when they come out, they actually call the dentist first to have a look at their mouth before they decide what dosage to give to their patients to monitor the progress of the transplant, whether to continue with their treatment protocol. But what brought me into three, my husband and I joined three exactly 12 months ago, Kassy. And it was really an extension of our search for something that is pure, clean, something that works with my healthcare background. Being physician listed, physician PDR listed, vetted by doctors is very important to me because I'm still registered in Australia. So, nobody's going to believe me if there's like no third party testing, not supported by the healthcare environment. I know the opportunity is enormous, and that's why I step up to speak here widely as many times as possible so that people can see, people like Kassy, me, and the other three other speakers who are going to join us, who are the people using these products and what transformation these products are able to make to our lives. So my husband's life and my life have improved tremendously in the last 12 months, more than we did in previous years. And we attracted to it initially by the products, but we also love the leadership. We know some of the people who have are in the leadership platform and roles at the moment, and we just inspired by their servant heart. We love the whole platform. It's because of this company I get to meet you, Kassy. You are across so far away from me. I'm this little beach town. Not many people heard of Port Macquarie ever. But if you come to Australia, come visit me. You got a friend in me, okay? So
Yes.
yeah, so it's a no-brainer for us, extension of our love for wellness. And Andrew and I have been, at a personal level, Andrew and I have been married only for 4 years. We are in a we're actually senior citizens age group, but we're forever young. We have a young heart. So we want to, of course, continue proactive lifestyle, pro-healthy aging, for as long as possible, God willing, to pass 100 years old. So I think this company has the solution for us.
Well, definitely you can, I mean, all of you guys that are watching, you can see from Dr. Hong and in her appearance, she's putting the right things inside her body, making her insides healthy, because the outside, I mean, you say you're a senior citizen. I mean, are you kidding me? You absolutely do not look it. And I'm so thankful that the things about three that brought you here is actually healing you from the inside out. So when you talk about three, can you tell me like maybe the top three things that stand out because of your healthcare background?
Yes, yes. So because of my healthcare background, also initially as a clinician, dental surgeon, so I'm a doctor in dentistry, to make that clear. But I worked in the medical sector for also a long, long time in leadership roles. So I actually used to read 11 medical journals every month.
Oh
So
my goodness.
I do have quite a balanced perspective of the healthcare system. So what stood out? What stood out for me for this company? There are more than three things, but basically, the company believes in people as the main asset, and I like that because in all the service delivery, even when I was in leadership role, I valued people. So it's in alignment with my values. And then we all have a common purpose and a mission. I work in mission-driven organizations. We all have causes, and I champion those causes. And that's why, I was a trailblazer in many ways for the organizations I work for. So I like the idea that we all have a common mission, focusing on well-being and proactive wellness. It's really so relevant in today's world to take back some control of our health and reduce the reliance on hospital or medications, and many other modalities contribute to our well-being. But I know that it's the mind, body, and spirit, right? You can you can do all your mindset exercise and listen to all the mindset podcasts. You can feed your spirit, but you also need to feed your body with nutrients. So we have the answer to that. Also, on top of that, is the positive community that we have created in this platform. Never did I dream in 12 months. My network just grew, and I have friends all over the world in 14 countries, all with a common purpose. I love that. But the science behind it is also very important, which is the curation and then the discovery. Oh, we are not a copycat. That's why we got listed immediately. As soon as the company launched, all our products are physician PDR listed, because we are not a copycat. It's our ingredients, our formula. And on top of that, we have 11 cellular absorption technology. So all those things make us stand out from everything else in the world.
So speaking of advanced delivery and speaking of, feeding your body nutrition, can you tell me what your favorite three product is?
Oh, Kassy, that's an unfair question. I have two adult kids. My husband is 5, so together we're a blended family. We come together late in life. I will not tell you what is my favorite, because all 6 are my favorite. And this is how I use them. I use them with my husband and I religiously. Every day we take them. Every month we use the products. So we've been doing that ever since we got the products in our hand, which was last year. And we often say, and not only we say, other people say, you are walking living proof of the transformation in both of you. With the vitality we take every day, just as our foundational health, I won't go into details of the science and the ingredients in there. You can ask the people who invited you here. We can send you more information. But that's my foundational health. So I use that every day. First thing in the morning, I would take a sachet, which is a packet, and that, of course, looks after fills in the gaps for everything, because I'm not very good at preparing meals. And it will take me a long time to make sure that I have so many milligrams of this, so many milligrams of that. I have all the vitamins in there. Even if you are a super duper nutritionist dietitian, you can't guarantee that what you put into your body actually works. So that's my foundational health thing. And then my collagen, I love my collagen. Everybody loves the collagen. It is actually my skincare from inside out. We in Australia, we have very harsh sun. So there is a campaign going on for decades already to slap sunscreen on your body and all sorts of protection. But that's only from the outside. So from inside out, collagen is my go-to solution for my hair, nails, and my skin. And also it gives me the immune support as well. And then we have the Eternal. Eternal is a must. I don't take one. I take, if I can, I'll take 2 or 3. The recommendation is to take one, because we drink great wines in Australia. I'm not endorsing or proposing that everybody drink wine, but there is a wine culture in my country. I never used to drink wine when I was in Malaysia. I was born in Malaysia, but I started liking wine. I'll have a glass of red wine with my meal every day, almost every day, and we have some alcohol-free days too. But I would have to drink 200 glasses of the best quality Pinot Noir to have just one sachet, or to have the same amount of resveratrol in this sachet. I get
Yeah,
my
in
200.
America, they did a similar study, and it was like 486 bottles
Yeah,
I
yeah.
mean,
If
that's how little nutrient in America that we
yeah,
have
that's
in
right.
our grapes that transfer into the wine to get the
Exactly.
resveratrol. It's crazy.
It is crazy. It is crazy because the soil is depleted, and you know what used you're able to get from your red grapes no longer is true anymore. I have many wine grower friends because we live in regional now, and then we have, lots of wineries around us. So they always say, "Come on, have another glass of red wine. This is my dosage of resveratrol." I say, "You're not getting about maybe less than 1 milligram. I'm getting 200 milligrams just with this." Yeah, so anyway, that's Etanel. It also has the glutathione, and during the pandemic, there were studies that came out. There were new research at the time published on it during that era, that people who actually didn't recover or actually died in hospital from the crazy world all had low levels of glutathione. So as a result of that study, which I share, many people went looking for glutathione infusion, but who wants injection? Who wants injection of glutathione into your body? And it's very expensive. You can't really control the quality of it too. So that's my easy, safe go-to product. And then of course you got the Revive, which we call Miracle Gel. That's the one that is a game changer for my husband for his sports. And then the Purify for my gut health as well, and detox, gentle detox, and then Immunate. There are three testimonials coming up, and I can touch on these products a bit more later. So I can't say which one is my favorite, Kassy. All six are my favorite. And I always say to people, if you can stretch it, if you don't, you have to invest in your health, because if you don't invest in your health, you have to spend more money later on in your sickness. So that's
Yeah,
my mindset.
yeah, no, I totally agree. I mean, you're going to pay for it one way or another. Either you're going to pay for it in poor health and the amount of healthcare costs, or you're going to have to pay to be proactive, and you're going to save a lot of money
Yeah,
by being proactive in it. And it's not just, what I love about it is we use the word proactive. We use it because it's separate from reactionary. But at the same time, if you feed your body what it needs to affect malnutrition, toxicity, inflammation, and oxidation, your body is amazing. And even though we can't go backwards and totally fix what's already been injured, the body's pretty amazing and can heal itself, but also make other mechanisms of ways that your body can excel, right?
indeed,
Yeah.
indeed. Yeah, yeah. The epigenetic studies that we have showed that.
Yeah, definitely. And I'm really excited to hear from the real people that are getting real results. But I just wanted to comment on one thing that you talked about, back to the glutathione and back to the issues from the pandemic. I know a lot of people still struggle with issues, and you and I, when we were talking yesterday, um, we talk with people every day that have
Right.
these, new symptoms, new autoimmune conditions, all these new, they call it long COVID, and different things like that. When you speak about the glutathione and the research that's been done about COVID, the people that were affected the most were the elderly. Well, glutathione is something that you make in your own body. It comes from your liver. And when you're young, you make a lot of it. And as you age, you make less and less of it. So it makes sense that the studies are now showing us that, which we already knew, it was affecting the older population. Yes, it affected the younger too, but it was more rare, right? Right.
Yeah.
The
Yes.
biggest risk was, as you aged, the effects of it. But I love that, the nutrition that we have, including the Purify and the Immune, they have nutrients in there that bind with that spike protein that people got from COVID that can help flush that spike protein out. And we notice what with their health? What are you noticing? Changes, right?
Yes, yes. No, I again, we must not claim that our products treat, cure, prevent, or diagnose, and these are all just testimonials, just stories, testimonials.
Yes.
There's even a study in a university in Queensland, and they are doing a survey of all people, and I got sent an email because I have friends in that category of suffering from the long long COVID for more than a year now. Well, we are since 2020, and yeah, I think more research needs to be done. There's no one solution to all. It is all encompassing, but certainly, if you look at all the longevity studies, all the studies that lead to to prevent cellular damage, premature aging, healing, capacity to heal and repair, even in your brain, the neuroplasticity, it all boils down to feeding your body cells at mitochondrial level, cellular level, with the right nutrients. So it's on that basis that I tell people that, something that is happening or has happened is disrupted your body balance of all these nutrients, and something else not working. So you got to put yourself back into a balanced state by using this one system, 6 products, where all the ingredients work together to give you the optimal well-being. So that's the angle that I come from. Yeah.
Yeah, no, that's great. That's amazing. So now we're going to get to hear from these real people with real results. And I can't wait after they share their story for you to, add in why you think they're experiencing, these health transformations, so that you can shed a little more light on more of the products and more details. So I think we're going to get started with the first, my friend, Marisa Mangimeli. She is an interactive health and functional nutrition coach. I'm super excited to have her on and her to share her testimony, because it is life-changing.
Hi,
Hey, Marisa.
Kassy. How are you?
I'm
Thanks for having
good.
me
Welcome,
on. Hi,
welcome.
Dr. Carolyn. It's so good to see both of you ladies. And it's fun to be on this end of it as well. So first, loved hearing your conversation. It was wonderful. And I want to touch on one of my favorite products, which is Vitality, Vitalite, however you want to pronounce it. But it goes to a lot of what Dr. Hong was saying and what Kassy's saying about malnutrition. And so many people hear the word malnutrition, and I think they also think like somebody who's like weak and frail and maybe underweight, and don't realize that actually a large percentage, especially of the United States population, would fall into the malnutrition category. And what it actually means is a lack of quality nutrition that your cells, like Dr. Hong said, that you need at the cellular level for the body to be able to function and thrive and the systems to work the way they're meant to work. So Vitalite is like a favorite for me, and being in the integrative health space and functional nutrition space, I love it because it's like it is the foundation. Like Dr. Hong said, it's such a phenomenal foundation, and it really, really helps people just feel better. Like I have a lot of people that share with me their energy levels are better. Their GI function is like, that's a big one. Their GI function is better. And for me, what led me into integrative health was my own autoimmune journey about 13 years ago. And I ended up choosing a holistic route after a year and a half of all kinds of traditional medicine. And that led me to eliminating some foods from my life that really helped me, because there were certain foods that were triggering me to have inflammatory responses, which led to me feeling very bad. So for years, I diligently had eliminated 4 foods that kind of were at the top of those triggers. And I would always try to reintroduce every once in a while and still have, things happen like headaches or even some neuropathy. And I can just share, like, you guys, this is just my testimonial. I have tried all the things. I have spent probably thousands of dollars on probiotics and other things to really help my gut microbiome come back to a place of stasis, right, over the years. And so the first thing that ever did that for me was actually Vitalite. And I didn't know it really at first until I heard other people's testimonials about, oh, well, I can eat cheese a little bit more without upset, or I can have gluten every once in a while and it doesn't really bother me if I'm taking the Vitalite and adding the Purify. And I'm like, oh, I want to try these things. I really love croissants. Like, honest to God, that is like, everyone's like, what's the one thing you miss? I'm like, it's a croissant. That's the only thing I want to eat again. And I don't do it often, but my gosh, if there's a really well-made one, I want it. And
Oh,
I love
good.
that I can now have that once in a while without getting headaches, from the gluten sensitivity. And the only thing that has changed is the addition really of these products. And I truly believe that's one of my more consistent ones. And it has the digestive care blend. And, I love it. It's just, and I'm not the only one that has that story. I heard other stories, which made me try to actually reintroduce again reluctantly. And I was like, oh my gosh, this is actually, this is good. I feel good. So that's one. And my other one, which I really want to share because I know it has helped a lot of other people. I have been an equestrian my whole life. I was a professional equestrian for over 20 years. And I also was an athlete, like beyond an equestrian athlete. I ran track and long jumped and sprinted. And my right knee is just, both my knees are not the best, but my right knee is bone on bone. And last year, like really right before we launched 3, because like Dr. Hong, I joined a year ago as well. Right before we pre-launched, I was just hurting. I mean, I could not get down the stairs easily. I'm only 45 years old. I've been physically active my whole life. So not only was that physically limiting for me, like I was actually scooting down the stairs on my rear end some mornings because I could not get down my stairs. So it was physically limiting, but then it became very mentally limiting because I'm somebody who likes to be active. I have a now 6-year-old daughter, but she was 4 years old at that time. And it became very challenging for me physically, mentally, emotionally. I gained weight, all the things that go along with that, and I'm sure that resonates with somebody. And when we launched, I just saw the ingredients in our collagen, and we use those ingredients a lot for performance enhancing and joint support in the horses. And I was like, oh, please, 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 please help my knees. And I thought I'm going to give this 3 to 6 months. When I work with clients and they're trying something, I always share with them, like, it took you how many years to get here? You have to give it time to recuperate. And again, guys, there's no like guarantees. This is just my experience and testimonial, but 5 days, it was in 5 days. I was like, well, I went up and down the stairs like a bunch today. I didn't even think about it. My knee doesn't hurt. And then I was like testing it out, and then I went for a walk, and then I went for a run, and I hadn't run in over a year. So it's a game changer for me. Like, when you can remove that limitation and do things that make you feel good, both inside and outside, I think that's just like one of the most important things. So it makes my skin look nice, and that's nice too. But for me, like, the collagen is golden because it gave me activity back and it gave my knees back.
Yes. And well, and I find that people here, well, that's just part of aging, like the creaks and cracks, that's normal, the struggle to get out of bed, all that stuff is normal. And I love to hear your testimony, Marisa, because people need to hear that, because it's not normal, and you don't have to accept that as your overall health. So, Dr. Hong, talk to us. Tell us why you think the products that she's taking is giving her the experience that she has just shared with us.
Yeah, thank you, Marisa. What a wonderful testimony. I love listening to you. I've heard you before, but every time you speak, it sort of, reminded me of, oh yeah, I heard the other day this, I heard the other day that. Oh yeah, I forgot to mention this. It all boils down to the 11 cellular absorption technologies that we have that other products don't have, which is what got all our products, physician PDR, listed so quickly. Right. So therefore it is so useful, even just being listed for the consumer as well as for the health professional who's never heard of it before we can point out to the doctor and just say, oh, by the way, these are what I'm using, you know, what you're prescribing to me, will there be any interactions or contraindications? And even you yourself, you can take back control too, because you can type in on the PDR.net your medication, and then you read all the details, and then you type in PDR3, read all the ingredients in there, and then you can actually do a little bit of research yourself before you go to a doctor. So it makes you a more informed consumer. But your case of your gut health and riding on horses, that in a way is a very similar story to my husband, except that he rode waves, ocean waves. He is a keen surfer. He has been surfing since he was 10 years old. I'm not a surfer, but I love the ocean. So when the pandemic hit us, our income dropped by 90%, and our world sort of closed around us, because we were in consulting and we were spending about 100 days in every year outside of Australia, multiple countries. But it also was a blessing, because it made us stop and realize that our lifestyle before was so toxic. The pollution of some of the countries we go to, the air quality is hazardous for human life. And then also the different time zones affected our sleep. My gut health was my main issue. And like you, Marisa, you know, the products heal my gut so quickly. Again, it's my testimonial, my personal story, because for more than 10 years, I have been to so many different physicians. Having worked in a healthcare environment, I have access to all these people. They put me through tests. I might get better for a little while, and it comes back. So it wasn't sustainable. And it was also mentally and socially embarrassing as well when you have gut issues. You know that. So using the Vitality products definitely helped my gut, but the Ibane actually also contributed to my gut health, which then therefore gives me a happy mood, which I truly believe, again, my own testimonial, why I'm always happy. Because of the calm energy that Vitality gives me, and also the Ibane, that I know the gut and brain connection. So I'm always happy. You see me smiling all the time. So great testimonial, Marisa, and I applaud you for sharing your story.
Thank you.
All right. Well, moving on to Elaine Catuara. She's a friend of mine. We met through the proactive wellness space years ago. And I love hearing from Elaine about the changes that, you know, her body has made since she started with 3. So welcome, Elaine. Welcome.
Thank you, Kassy. It's such an honor to be here. Thank you for asking me. Always learn so much on these Wednesday wellnesses, and I enjoy it.
Great. I would love for you to share with everybody your story, you know, some things that you have noticed that has kind of transformed your health.
Yes. Well, gotta say we've been talking about Vitality tonight. It is my very favorite, and I have a couple big reasons for that. I would start out about 10 years ago, I had migraines very frequently. They were hormonal, as it turned out, but as the only thing that could get rid of it would be the ibuprofen or any of the NSAIDs. But ibuprofen like candy, I was popping it, and it was the only thing that took care of it. And so I didn't see those results for a couple of years, but it turned out I was having lots of gut problems. I needed to go find a map of every building that I was going to know exactly where the bathrooms were, because it was going to be an emergency if I needed to find one. So I finally took care of it. I went to a doctor, found out what was really going on, and I gave myself microscopic colitis, as it turned out. And it took a couple years to treat that. So I try now. The moral of the story is stay away from those ibuprofen like that. Don't eat it like candy. So now I don't, unless I have a really bad headache again. So it is really still the only thing that takes care of it. So I will take a couple, and it usually gets rid of that migraine or whatever little bit of headache I have. But I don't have to worry about those gut problems anymore. And at first, when I started taking Vitalite, I thought, oh gosh, I hope this is really going to help me. And I had no problems whatsoever. So it was such a blessing to have the Vitalite that takes care of my issues. If I have a headache and need to take some ibuprofen, I'm all set. I don't have to worry about that anymore. And then the second reason I love Vitalite is because I have been practicing intermittent fasting for about 3 years. And I've always wondered which nutrients I'm missing out on because you can't get all of those goodness, all the veggies and the fruits and all the greens that you need, all the nutrients in our bodies just from 1 or 2 meals a day. So I was very pleased because I just thought, oh my gosh, where am I going to get all? I can't eat enough fish. And then when I started reading the box of the Vitalite, I thought I am all set. All of these boxes are checked. It was fabulous. So now I don't have to worry about that. And if I do cheat and have, an awful day, I know that all of those nutrients and then the Purify later that evening will help too. So I am pretty much all set. And there's just no way that um, you could get as much as in the Vitalite. You couldn't get all of that in your diet in one day. It's like a meal replacement. It's fantastic. So that's what I think about Vitalite. I think everyone should be taking it.
Yeah, I mean, obviously you can tell from everybody that spoke here that, bridging the nutritional gaps is a really big deal. I think across the globe, but especially here in America, the culture that we created as far as, making things very easy, and the way that we eat processed foods and all of that stuff, everything that Elaine talked about. I will tell you, being friends with Elaine for as long as I have, when she talks about, headaches and how she used to take ibuprofen like candy, that is actually very true. She has a lot less headaches too. But I love that, she doesn't have to search for a bathroom, it's a really bad feeling when you travel, you have to plan for bathrooms and being able to know where they are, especially when it's the gut that's messing with you, because a lot of times the gut doesn't give you a lot of warning, which happened with Elaine. So Dr. Hong, why don't you, just kind of touch on some things that Elaine shared with us and go from there.
Yeah. Thank you, Elaine, for sharing that. Because we are hearing now more and more that gut health actually affects nearly everybody, because we actually don't have the microbiome in our gut to like function perfectly. And as you correctly said, so Elaine, you can't even get you won't even be able to, even if you with the best intention, even if you have a nutritionist background, you find that it is impossible, really impossible for you to first of all get all the products which has the ingredients that you need that will match Vitalite. There's no way I would be able to walk into a supermarket or pharmacy and say, I want 72 trace elements, please. And they will know where to start, right? And then, and plus all the other things, and probiotics, prebiotics, and all the other digestive enzymes, A, B, C, D, all in one. I said, not separately, not 15 bottles, which was basically 10 to 15 bottles I used to use. It's true. Right. Yeah, during the lockdown, and I'm embarrassed to say, people in the lockdown, I don't know what happens in America, but in Australia, especially in regional towns, the supermarket is always showing no more toilet paper, no more toilet paper. We didn't worry about that. We actually rushed to the pharmacy and stock our basket with supplements. We want supplements, we want supplements. That was before I even knew about 3 or, quality nutrition supplements, because we were more afraid of not being able to access food, and then we have no supplements. So what you have is an easy solution, and I value that so much. Just by way of example, just in the month of February, we travel a lot. We still do travel a lot now as a couple, and then we make sure that we take the first thing we pack actually are the 3 supplements. But over 16 days, we drove on a 4-wheel drive on the road from east coast of Australia to west coast of Australia, 10,000 kilometers in a 4-wheel drives over 16 days. And I took all the supplements, and every day we are like a new person. I have no gut health issues. I actually, when you go to remote areas, it is very hard to find where's the nearest bathroom. So when you shared that story, which I dare not share, I was too embarrassed to share. That used to be my life when I travel. First thing is, where's the bathroom? Where's the bathroom? Yeah, so no, I think we are all on the right journey here, and it's not only the vitality. I found that Immune also helps because Immune has got the the innate blend and also the immunity blend, the adaptive immunity blend, the quorum sensing blend, and it also helps our gut bacteria, and
Yeah.
80% of our immunity is from the gut. But so it's all combined. The fact that you don't have to take medication anymore, which was what my husband took before. He had to take ibuprofen, he had to take painkillers before he could go surf, and he comes back, he's always exhausted. Now he can surf like a 20-year-old. And taking these products, which I like to just briefly touch. Recently, as part of my annual health check, I for the first time, my GP sent me to a cardiologist to have this is the new trending thing, which is your cholesterol count of blood works. It's not a good indicator of your heart health. So they persuaded me to go and have a ECG and then a CT calcium score. And he rang me and he said, Caroline, I don't know what you're doing. Whatever you're doing, please keep doing it, because you got at your age, you got a heart health, like healthier than somebody 20 to 30 years younger than yourself. So I laughed. I said, not only am I young at heart, I have a young heart. My cardiologist confirmed that. So Elaine, I think you're on the right path. Keep doing what you're doing.
Thank you.
Yeah. Yeah, thank you, Elaine. And then finally, my last friend to join us is Raquel Enriquez. And again, she has a tremendous testimony, and hers is also related to her gut health and just, how debilitating it was, and then how 3 has transitioned her health to kind of have a whole new quality of life. Welcome, Raquel.
Hi, everyone. I'm Raquel. Thank you, Kassy, for having me on tonight. I'm so excited and so honored to be here with everyone. Thank you.
You're welcome. We're excited to hear your story.
Okay, well, let me just jump right in. In 2007, I got really sick. I went to the ER, and after about 5 to 7 days, I came out with the diagnosis of diverticulitis. Didn't know what it was kind of, taking the antibiotics. And from that point, from 2017 to just before I started, or right when I started 3, I've had countless of flare-ups, hospital stays, discomfort, bloating, constipation. On the contrary of these women sharing that they're looking for the bathroom, I was homebound. I did not want to go anywhere because I just lived in the bathroom. And I just looked pregnant. I had no energy. It just took all of my energy just to get out of bed every day. And when I found 3, I can say that within, I want to say between 3 to 5 days of taking the product, it just went away. I don't know how to explain it. The pain, the discomfort, the gas, the constipation, all of that is gone. I have energy. That was one of the first things that I noticed was the energy. I do work out every day. I sometimes do 2 a days. I work out in the morning at 5 a.m. and then I go and do cardio in the evening with my husband. I feel great. I'm the whole quality of my life has completely changed. Currently, I breed French bulldogs, and I have a litter of puppies, and I am waking up every 2 to 2.5 hours to help feed these puppies. Mama didn't produce any milk, so I feel like I did when I was having my own children, waking up, and I don't feel that I'm not tired. You guys, I'm on like maybe 4 hours of sleep right now. I am not tired. I mean, I'm doing this, with you guys, I should be like taking a nap. But yeah, I feel fantastic. I just cannot say enough about the products. I am taking the Vitalite, and Purify are my best friends. Eternal, and I love the collagen.
Mm-hmm. Yeah, no, I remember our very first conversation that you and I had. It was about, after work, you were spending a lot of time on the couch. Your husband works out, and that was something y'all connected with, and you weren't able to do it because you just had no energy. And I love that now you're able to do not just one workout a day, but sometimes 2 workouts a day. And
Yes,
I
yes.
cannot imagine getting up every 2 to 2.5 hours and not being tired, because when I had my kids, I just felt like I lived in this fog the whole time because, I felt like my brain didn't even work because there wasn't enough sleep. And I love your experience, Raquel. I love it. You and I talk probably once a week, and I just love the changes that I've seen in you. And I can't, Dr. Hong, I can't wait for you to, shed some light on. Obviously, she takes more than just the Vitalite. She does do it as a system, right? She takes the products as a system, and her and I chatted a lot when she first started with 3, and she did notice some big changes on starting day 3 to 5, but progressively we've watched the transformation happen. So it was like it just was that she felt so different on day 3 to 5, but a lot of the changes has happened months after, taking the products, because it didn't happen overnight. She didn't start struggling health-wise overnight. And so we know that her, getting to where she is now didn't happen overnight either. So Dr. Hong, you've got some things to add?
Yes, definitely. I love it that you use it as one system, because that's how my husband Andrew and I came in when we got our products. We were the first founder pack people in Australia, and we were like the guinea pig for the company on clearing customs, answering questions, and telling everybody about the products. What? 3? Never heard of it. And then, sending information. And so now it's very easy for us. We get our products within a week. So it's fantastic. But I like the fact that you're using it as one system, because Dr. Dan Gubler is an expert in phytonutrients. He's an expert in also cellular absorption technology. So we already have the best chief scientific officer in our company. And on top of that, we have other people, acclaimed, accomplished health professionals and doctors and medical specialists on the scientific advisory board to work together with him. So our products are unique. So as a system, the way Dr. Dan Gubler formulated them is as I said in the beginning, that we are not copycats. So all the ingredients are our ingredients that he has carefully selected because of his scientific background. And also the absorption technology, some of them are he has 16 patented and granting. And so it's his as well. And then again, to have them physician PDR listed. So all of them individually, each product has its benefits, optimal benefits, because you can't actually there's more than 100 ingredients in all our 6 products. You can't actually have a macro one supplement to have all of them. So he's very cleverly put one product, Vitality, all the ingredients actually work synergistically with each other, so that 1 + 1 gives you the 8 effect, not 1 + 1 - 500, which was what was happening to me, because I was acting like a curator. Oh, this doesn't work, I'll take more. Oh, that doesn't work, I'll take more vitamin C, I'll take more probiotics. But everything just went haywire, and I had worse and worse gut health issue. So the fact that you look after your gut health first is like the trigger, the beginning, because one thing flows to another. When you heal your gut, you heal so many aspects of your body. When you take the Vitality, it gives you the calm energy. So everything else, life just become easier. And testimonials like what has been shared tonight by Marisa, Elaine, and Raquel are not new to me, because over the past year, even as recent as yesterday, I again heard from one of my ladies in my group in Australia. And she said to me that you saved my mom's life. She says that to me nearly every time that I meet her. Her mom was 91 when I first met her, turning 92. The mom, only after less than a week of taking the Vitality, the mom actually said, it's the first time in 10 years. She's a very educated mom, 92, very cognitively sharp. She was a counselor, teacher, a pioneer in education in Australia. So she wasn't dumb, and she knows science as well. And she said, for the first time in 10 years, this poor lady, I don't feel constipated. I cannot sleep. And also another thing that she experienced, she said, I had undiagnosed pain that nobody believed me, and they're giving me more and more drugs. So she was like drugged. And the first time I met her, also like, it was blurry. She's had like a mental fog. I had those symptoms too before, feeling tired and all that. But if now she doesn't, she's very sharp and she's happy. The calm energy is what she experienced straight away. The constipation went away and she is happier. And as a 92-year-old, she just wants quality of life. She said the fact that I can enjoy my grandchildren, my great-grandkids when they're around me is all that I'm after. So our products are actually life transforming, and we are actually in a field of saving lives, really, although we can't claim that our products treat, cure, prevent, or diagnose. But all the testimonials that come out, what we're doing is adding quality to people's lives. And it's good for, I must add, it's good for children's health, family health, men's health. You should think deeper than that, men's health, women's health, think deeper, what affect women, and elderly health, and relationship health.
Yes. Yes, exactly. Well, I really love tonight. I love just being able to talk to so many different, individuals that have experienced such great things with these products. And I love, hearing from you, Dr. Hong. You bring such a specialty to and knowledge to, it does hold a lot of weight that physicians are interested and are, starting to really take note of proactive wellness. And I appreciate you pioneering in Australia so much, not just your past, but now you're pioneering a lot of proactive wellness in that space. So I truly, truly appreciate you. Thank you so much for jumping on. And thank you, everybody that, shared, their health transformations, their health journeys, and their struggles, because it's hard sometimes to be so vulnerable that each one of you are. We talked about some tough stuff that a lot of people don't want to talk about. So I appreciate you guys so much. And those of you that tuned in, we're super excited that we got to share what our passion is with you. And you guys have a great night. Dr. Hong, do you have anything you want to add before we sign off?
No, I just want to say thank you to all you beautiful ladies, and happy International Women's Day, wherever you are.
Yes. Happy International Women's Day. All right. We're signing off. You guys have a great night.
Thank you.